Radio Live News, up to the minute.
Kia ora, good morning. Welcome to News Hub.
BFBS.
It's uplifting.
The laughs that we have.
One of the best radio stations you can listen to anyway.
This marks an important week for a lot of people here in the UK because we are talking about the patient participation group and why do they matter. Well, joining me first of all, we'll talk to Gemma. How are you doing, Gemma?
Good morning.
Good morning. You sound very lovely and bubbly.
Well, it's sunny and warm in Lancashire. I believe it's raining in most places.
Unfortunately, it is here. But why is the patient participation group so important to us?
Well, I think they are the most important things in our lives, really, because your health matters. And to have a group of people who care for you in your surgery and have your voice and can voice it to solve matters, see that things are perhaps not running quite as they should be, to bring up points that they find that wouldn't come out in a written survey, because a written survey is far too broad. It doesn't really get to the nub of what is going wrong in their particular lives. So I think they have such a lot to offer to a practice. I mean, the benefits are enormous. With our practice, we were awarded an outstanding award, and part of that outstanding was mentioned that the PPG had contributed greatly to the outcomes of the GPs.
When we make our recommendations to, you mentioned this, to GPs, are they surprised at some of the findings, and if so, how?
Well, I think they're very. In our practice, they are very attuned to what is happening, but they are medics, and to be honest, that's why they're there. They see their patient, and they are a medical body most of the time. We are that conduit, if you like, between the doctor, practice, admin, and ourselves and them. And they will talk at length about any problems. I'm quite surprised, and I think it's because for 4 years we've done that. We've been in the practice with the patients because that's what we think is the most important thing to do. Having said that, we concentrate on other things too. We go out into the community, we go out into schools, because that's another time bomb, childhood obesity. So we started 3 years ago a Healthy Heroes campaign, and going into primary schools where they had carrots for Superman and all different things that were based on primary school children towards healthy eating and healthy exercise. And they produced posters, they did all sorts of things. They came into the practice, we went into the schools. It's building and forging these relationships with a community that you don't often see in the practice. So that's one part of it. The other part is to go into supermarkets, again, when it's all comers. And very often, yes, they're into shop and they don't want to, but we're going into the third year now for the flu clinics, when we get a real surge of people wanting advice about their flu clinics. But we don't just do that. We do health checks, we do AF checks, we do blood pressure, all sorts of things within the supermarket. And we're seeing, you can't miss that we're a patient participation group and we represent them. And these flu clinics, flu fighters we call it, they have been really successful, and the uptake of the flu vaccines and explaining what the vaccines are is very important. So, we don't just stay in the practice. That's our priority. I must emphasise that. But we're going out into different areas where we can...
Can I add that? health is about a partnership. It's about a partnership between the medical profession, the nursing profession, and those who look after us, and us as the individual who has the problem. And remember, we do not choose to be ill. So we need to be involved in this tripartite, or whatever one calls it, this circle. Not just an add-on, but part of it. And this is what a PPG is. It's part of the partnership.
Yeah. No. So what are some of the current changes facing the PPGs, Patricia?
There are lots. There's
How long
there's a movement from government that GP practices, who must now have a PPG, it's part of their contract, are being asked to move, or recommended to move to bigger and bigger and bigger groupings. Yes. Primary care networks is one of the words. That's
neighbourhood.
Up to 50,000 patients.
Wow.
Perhaps even more. Now that's a lot. The practice sees the people who are poorly. It doesn't see the others who come seldom. But the PPG lives in the community and knows people, so it can help in that respect. So there's a problem about size. There's a problem about access as well, getting appointments, and that may be covered on another occasion. There's a problem about the amalgamation of PPGs. So if you have 4 rather small practices that become a part of a bigger grouping, there is a temptation by the clinical commissioning groups to reduce that to 1, if you're lucky, 2 PPGs. How can these small number of volunteer PPGs cover this very wide people?
Right.
Can I endorse that, Patricia? Because I really, really agree with Patricia on this. It's a really important thing for me. And Patricia wasn't very well earlier on, and she asked if I could go down to Birmingham to address a PPG conference, Birmingham and Solihull CCG. Yeah. There are 177 practices in that CCG.
Wow.
And just what Patricia said, a lot of PPGs had to amalgamate, and those poor PPGs were disparate, disenchanted, and they were just disintegrating basically.
Wow.
And it was just so sad because they'd been clumped together in very disparate areas and expected to work as a PPG. Very unsatisfactory. Very sad, really.
So do you mind?
And so I was trying to inspire them, and I thought, how do you go about this? You know, some of them had been disbanded because they had to join with somebody else. Now, if that was to happen to us, I would feel mortified. Absolutely. Now, all the good work we're doing and are going to do and are planning to do for the next year, we've already got the plans in place. Well, how do you work that out? I just don't know. I just don't know.
For Lauren, if you want to find out more about PPGs and how they can get involved, where can they go, please?
So I would suggest actually they go to our website, which is www.nap. That's napp.org.uk. There's a lot of information there, case studies, tips, information. Often you'll also find that your general practice also has a website with information about the local PPG, your specific PPG that you can join. We're also on Twitter at PatientParticip, which is participation without the ATION at the end.
Lovely. It's been great to talk to you. Thank you ever so much indeed, guys. And good luck with all the work you do.
Thank you.
Thank you. Bye.
Bye.
Bye-bye now.
If you can just tell me your name and your role, please, if you would, Gemma.
Yes, I'm Gemma Jackson. I chair a patient participation group in Thornton Cleveland, the Thornton practice. We've been going now for 4 years, mainly because it was a contractual obligation of doctors to have a patient group. They have been in existence since, for 40 years actually, and 40 years plus. But this was the contractual obligation that doctors should have one. Now, many doctors have an active group like we have, but some doctors will have a virtual group where they don't actually meet. So really, that's not very satisfactory. So we are very proactive in our practice in being the eyes and the ears of our patients. And so we really pick up comments, we have health promotions, we have all sorts going on within the practice where we engage with the patients, because they are the key people in the NHS, and it tends to be forgotten sometimes, and they're bypassed with services that they know nothing about, with treatments that they know nothing about, and we can help in that direction because we meet with the doctor and the practice manager frequently, and we can relay these concerns back to the doctors, and we get action, and that's the important thing. It's no good having all these things going on without there isn't a result at the end of it, and the results of having a patient group like ours are fantastic because the practice performs better because it's got an extra insight, that of the patient. And those things that you've had concerns about or patients have had concerns about have been put right, and they're very satisfied with things. It doesn't always go like that. It isn't utopia. We know that. But we know that our patients are very satisfied with their appointment system. We keep rejigging it all the time as things come in to try and field, any problems with that. Because that's a big issue, is getting an appointment. The next issue is getting an appointment with the same doctor. And that is always an issue. It's not always possible, because the larger the practice, if you're a one-man band, then that's fine. You'll see the same doctor. But if you're a large practice, but those doctors have their own particular expertise as well, which is we pinpoint. It's in our newsletter. We have information all the time. We're in the practice all year. We don't just flit in and out. This week is Patient Participation Week, so we're doing a recruitment for new members because people have been with us for 4 years, and it's good as well to ring the changes, but that we were that lucky. I think recruitment is probably one of the challenges as well throughout the country because of the age demographic. People who volunteer, by and large, are older people, and they're the ones who have the time. I mean, if the volunteers in the UK were to suddenly stop, the country would come to a halt, because so much depends on volunteers. And as volunteers, as I say, we're the first to spot problems with care. We're the first to get that information because we talk to our patients. It's vital that we talk and exchange ideas. And not only that, promote health issues, and that we go into the community as well and show ourselves that we are a patient group, that they do exist. They are important. So, as I say, I love being chair of my group. I really have a passion for the patients. And anything that I feel I can do and our group can do, and that we can be helped out by the practice manager or the doctor, they are only too willing to join in with what we want to do and to help us. And so the practice has been awarded an outstanding CQC report mentioning the contribution of the patient group, which is super.
So in terms of, obviously, you say that the people that get involved are generally of like an older demographic.
Yes.
What do you think can be done to try and engage
with... This is a big thing, isn't it, Patricia, is getting other age groups involved. We find this. We've tried all sorts of methods, but getting an actual person on a committee or a group and committing of an age is very difficult. So what we're trying in our practice is to try and get a youth PPG going. That would be ideal from our local feeder school, which covers our practice. We also promote ourselves, I suppose, because we can't have 5 and 6 year olds on board, but we can go into schools and say who we are, and we can get schools, which we do, come into our practice so they appreciate what's going on in the practice at an early age. And we've done that for the last 4 years now. We've engaged with schools in a big way for healthy eating, all sorts of things, because of the awful obesity rates. So we're doing that from that point of view, but as I say, trying to get a younger person, we think we could do it via secondary, and we think we could do it by sixth form. But it is difficult getting those younger people.
We could always also get older people by linking with other organisations where the population tends, not entirely, but tends to...
Good idea.
For the Women's Institute, or in Scotland, the Women's Rural Institute, that sort of organisation.
They might be the same age as us. I know ours is, but it is a good idea to try and link to some sort of younger organisations so that we can get them on board, which is a big difficulty, isn't it?
So in terms of the sort of people, obviously trying to widen the appeal and trying to get people in, what sorts of people can get involved with patient participation groups?
Well, Lauren?
So anybody can get involved with the PPG that serves the practice with which they're registered. And I think, as Gemma mentioned, it's really important that people take up that opportunity, because the services that are provided by general practice can be hugely enhanced by the input provided by PPGs, but that also requires that individuals who represent, as Gemma said, younger people who represent seldom heard from groups, ethnic minorities, all get involved and active in their local PPG so they can make sure that the services that are being delivered for their benefit are those which they would find most useful.
So obviously, the PPG has been going for around 40 years. What's been the biggest change in terms of how PPGs have been able to react with health professionals, and the way in which services have been sort of changed over that period of time?
I think, and this is Patricia, I think in England, because we're a UK-wide organisation, the biggest change is the pressure and movement, pressure from central government, to have practices linking together to form larger and larger and larger groupings, primary care networks and neighbourhood networks, so that there may be 50,000 more patients per unit. Now, if you're in a practice with, let's say, 6,000 patients, and you join with another practice with another 6,000, with another practice with another 6,000, and another, you can multiply it up. What the clinical commissioning groups have a tendency to want to do is reduce the number of patient participation groups. So they instead of having 4, if it was 4 PPGs, 4 practices, they want 1, perhaps 2 if you're lucky. How can these volunteers cover this wider area? It's a wider geographical area. It's not the area of where the PPG necessarily lives, so they don't know that community. And remember that the clinicians in the practice only knows those who come to the practice because they're not well. They don't know the wider community. They should, but they don't, so they rely on the PPG to know that. The PPG has got networks, links, tentacles that go out into the community, and they know who the people are, and they know where they can tap into. So that's one big challenge. The other big challenge is the use of technology, which is changing by the day, and it's dependent on the use of the internet.
Yeah, because it can be an issue if people, don't actually have access to the internet. It's great that everything goes online for certain demographics, but if people, for one reason or another, either they don't feel confident with the use of technology, or maybe they can't afford it, which is something that I think sometimes
that's one issue.
overlooked.
They don't have it. They don't live in an area where there is internet access. I mean, I know the government is moving to have internet access everywhere, but there are pockets, not just in rural communities, but in urban areas where there is poor or not very good internet access. And if you live in a basement, it may not have internet access. There's the other issue about not everybody has a smartphone or a phone, and even if they do, they may not anymore be able to use it because they don't remember, or they've got gnarled fingers that don't, the keys are too small. I mean, or they have a hearing or a sight loss, and they just can't manage. Yeah. And while the younger generation, the under 20s, under 30s, under 40s, and under 50s, are tech savvy, who knows what they'll be like, the under 50s, in 30 years' time when they're elderly. They may be exactly the same. We don't know.
We found that a big problem, Patricia, and it came to light at the first flu clinic because people received text messages that there's flu clinic on at a certain date. And so the first question, I think there were 10 of us in the practice taking data, and the results were phenomenal about the people who never used their phone. They might ring their daughter on a Saturday to say they're all right. And this was quite frightening, really. And we realised that that's where we've really got to act and to make sure that all the patients have information and awareness of everything, that the compassion is there so that they can do things with landline, that the leaflets are easy to read. So everything we did was to help that big cohort who didn't have a smartphone, who couldn't load an app, and like you say, didn't have the physical way of doing it either. And I think that's vitally important for us to have that compassion. And I don't think it really would have come to light so much had we not got all the data back from that first flu clinic. I was amazed at the results.
So in terms of people getting involved and for more information, where can people find information? Obviously, we've been talking about some people not having access to technology. So for those that can access it online, where can they get that? And also for people that can't, where can they find the information?
Brilliant. So we've got a website which is www.napp.org.uk, and that's napp.org.uk. That has a lot of information, case studies, tips, support, etc. But individuals can go and talk to the receptionist in their general practice. They can write a letter to their practice for more information. For those who are more tech savvy, we have a Twitter presence. So we're at Patient Particip, which is patient participation, but without the ATION on the end. In many cases, individual surgeries have their own websites that have information on PPGs. They have various sort of application forms. They have meeting dates, those sorts of things. So I think that there's a lot of information out there. But I think the first thing for individuals to do is to actually just speak to someone at the practice and see how you can get involved.
Yeah.
Okay, lovely. Is there anything else you'd like to add to any of you?
Well, we've got a big pop-up in our surgery that hits you in the face. patient participation group. We've also got all our pictures up. We've got our own logo. We really, you can't miss that pop-up when you come in. In fact, I'm taking it to the conference, Patricia, which is on Saturday at Cheltenham. I'll be popping in with my pop-ups.
And can I just add that we don't choose to be sick. And when we are sick, it is far, far more successful if we are partners in the partnership that look after us. So in our individual consultations, but also with patient participation group who can help clock up and make the practice aware of what's good, but what might not be quite so good, and can also alert the practice to potential problems that may be quite serious. And the other thing is continuity of care. We know that if patients have continuity of care, there is better mortality, poorer sick, better sick, they're not sick so much, and in general practice, they don't go off to A&E quite so often. Surely that's a price worth paying for.
So, the latest NHS figures revealed that 4 out of 10 people are currently stuck on waiting lists to see their GP, with an average waiting time of 1 month. The merger of smaller practices to form super surgeries has meant for those living in rural communities, the elderly and less mobile, access to a local practice is becoming more difficult. Well, to discuss this matter this morning, I'm joined on the phone by Dr. Patricia Wilkie, OBE, who is the president of the National Association for Patient Participation, Dr. Falarin Majekadumi, and Gemma Jackson, Patient Participation Group Chair of Thornton Practice, Weir, Lancashire, to discuss the importance of PPGs in shaping the future of primary care. First of all, thank you so much for your time today. Let's start off, Gemma, with let's go back to the basics. What is patient participation groups and why do they matter?
Good morning. Aren't you lucky being on the Scilly Isles? One of my favourite places, but very different with regard to health provision, I would think, from where I am, because of you being a Channel Island. So probably you have quite a good ratio of doctors to patients, I would assume, from my visit there. But as chair of our group, our patient group, a patient participation group is a group of patients who formed together, and we were initiated in June 2015 as it became a contractual doctor's agreement. Now, I don't know if it's the same on the Scilly Isles, but so a doctor has to have a patient group, in other words. And so we were formed then, and we've been going 4 years, but patient groups have been going for over 40 years within England, United Kingdom. So they're not a new thing by and large, but now they're a contractual thing. So that's an important thing to remember. So if you are a patient in a doctor's surgery, you should have a patient group. It might not be an active group that you can actually see them working or being there. It could be a virtual group, which isn't very good because the patient's group doesn't meet at all. It only has a phone call, or it has surveys. It doesn't actually meet the patients, and that's where we find that our role as a patient group is very important. So with the eyes, with the ears of the patient. So
in the Isles of Scilly, we have a local health watch that really does some fantastic work with working with people here in the Isles of Scilly and ensuring that they get the best possible health care. A location like the Isles of Scilly presents many challenges as well. We have a small hospital over here, and for some diagnosis, some even fairly straightforward treatments involves a treatment over to the mainland. Can you tell us a little bit more about the benefits of these groups and how they can really help ensure patients and
benefits
to the public
are amazing, because if you've got a GP practice who will work together with the patients, that's half the battle. So if you can meet with them like we do monthly, we can feed back the information that we have got by being in the surgery weekly. We spend a lot of time in our surgery. We value our patients above everything. They are the keystone of everything. And I think they get forgotten sometimes with the type of language they use, with the services that they provide that the patients know nothing about, with information. So we're a good conduit for that. We've got a superb quarterly booklet that we bring out that contains information for all our patients on all sorts of groups, particularly those that we can't reach, that may not come into the surgery. But there's all sorts of helplines, numbers, and these are all done so that there's an online number and there's a landline number. And this particular booklet is fantastic. It really is. The patients love it. In fact, the new one should be coming out for summer now, and the patients are all waiting for it because they want to see the news of what's happening in the practice, and they want to see additional information. They've got it. They can put it at their home and they can consult it. They don't have to go online. They can do if they want to because the details are there. So it's really giving them the information, and then we can gather that information as well ourselves, but also we're getting any compliments, complaints, trends. Trends are important, because if you get one or two patients saying similar things, then you know something's happening. You can't do that really any other way but by face-to-face.
All right, I'd like to now bring in Dr. Majeka Dumi. Thank you so much for your time. Effectively, who can actually get involved? I guess really anyone who is a patient attending a GP surgery.
Exactly, that's completely right. Anyone who's registered a general practice can apply to become a member of the PPG. In fact, if you're a carer, you can actually become a member of PPG where the individual that you're caring from is registered. And it's really important for people to get involved. And building on what Gemma said previously, it's really important that GPs, practice nurses, the whole general practice community understand local needs and are able to respond proactively. And what that requires is widespread participation from a range of individuals registered with those practices.
Dr. Wilkie, how is the growth of digital health changing the relationship between patients and primary healthcare providers? Obviously, here in the Isles of Scilly, we've noticed that consultations can be done with specialists on the mainland through online services such as Skype. I can imagine as technology plays a wider role in our lives, it's also impacting and making a difference when it comes to the speeds that members of the public can actually speak to their doctors.
Well, that's the wish. That may not be the reality at the moment. If I go back to your first comment about Skype and the use of that sort of technology, it has been used for a long time in remote areas of the UK for patients to be able to access a consultant about in a particular specialty where the patient lives much further away. And that is superb, absolutely superb. But remember that there is nothing to beat the actual contact between the patient and a physical person. A Skype conversation, a teleconference, doesn't allow the clinician to examine the patient. They may see them, but they can't see the whole demeanor. They can't see how they walk, whether they're, slouched. They can't necessarily see their colour, because the colour on the Skype may not be true. So there's a lot of disadvantages of that. There are advantages, and it may be superb for certain problems, but it's doesn't satisfy everything. Also, not everybody has internet access. There are pockets of the country where there is no internet, it just doesn't exist. I know that the movement is that everybody should have it, but there may always be little pockets where, even in urban areas, where there's very poor internet access. And if you live in a basement, there may be very poor internet access.
There's no denying there's people here in the Arceli. We predominantly have a slightly older age demographic in many respects. And
there's another problem.
Comments, phone calls. Well, we don't have computers, we don't have the internet, we don't use it. Therefore, I can't use this service. And obviously, any form of Skype or remote communication has its limitations in many respects. What changes would you like to see, and what are the challenges that you think you're facing?
There are great challenges in this. One needs to help people to be able to use technology, but there's a limit to how much one can help people use technology. So there will always need to be people face-to-face that one can actually see and speak to without having to use the technology. And even if people under the age of 50 are all adept, with their technology, how will they be in 20 years' time? We don't know. Possibly just the same. So one needs to be aware of this. It is very isolating, the dependence on technology. The fact that one doesn't speak to anybody, one gets money from the bank by going to a cash point. One does a self-checkout at the supermarket, and you go into a surgery or an outpatient department, and you self-check in, and nobody speaks to you. It's very, very lonely, and loneliness is a big issue, particularly with the older people. And that's not going to change because there are more people living longer.
Of course. Well, thank you for your time today. Finally, Dr. Majeka Dumi, I'd just like to bring you in to wrap things up. If you are concerned, if you would like to find out more information, if you would like to really try and, I guess in many respects, find out how you can benefit from being part of or getting involved in a patient participation group, what's the best way of going about it?
Brilliant. Well, I'd urge your listeners, I'd really advise them to go and look at our website, which is www.nap.org.uk, and NAP is spelt N-A-P-P. On the website, we have case studies, we have tips, we have information, we have stuff about healthy living. They can also find us on Twitter, those who are au fait with technology, at Patient Particip. And particip is essentially participation, but without the A-T-I-O-N on the end. Your listeners will probably find, actually, that many of their general surgeries have websites with information about the PPGs on them, but they can also ask the receptionist at the general practice. They can send in letters, etc. But I think, just to reinforce what I said earlier, it's really important that people get involved.
Thank you so much for your time today. It's greatly appreciated.
We're going to be talking patient participation groups, and on the line we have Dr. Patricia Wilkie, Dr. Falarin and Gemma Jackson, who's with the National Association of Patient Participation. So good morning, folks. And let me just start by saying that with problems on waiting lists and delays in seeing your GPs and your doctors, what is patient participation going to do for us? And can I direct that question to Gemma? Good morning, Gemma.
Good morning. Well, it became a contractual agreement in 2015 that all doctors' surgeries had a PPG. So it's a patient participation group. So the essence of the word is participation. So it's patients who are patients of that practice. They form a group, and they essentially are the cornerstone of patient and doctor liaison. And so you must recognise that patients are the most important thing in the NHS. They are the most important thing. That's why doctors are there. And so they're the people, patients and carers. Carers are a really good source of of information as well. They're sort of the smoke alarms, if you like, for the front line of the NHS. And they're the ones who are often the first to spot poor care, and they're also the ones who have the great ideas of how to make that care better because they're receiving it. So they need to be involved in decisions, not just about their care, but in getting better care for others. So participation groups are there. They're crucial to harness the voice of the patient in primary care.
So
and they have so much to give. To drive up quality.
Right, okay. So is that taking the care forward right across the board, or is it in specific sort of areas of care? Perhaps we're going to ask one of the doctors to give us a view on this.
Yeah.
So this is Patricia. I'm not a medical doctor. I'm a PhD doctor, by the way.
Good afternoon, Patricia. Thanks for talking to us anyway. So
not at all. It's across all aspects of what is offered in general practice. So it's the nursing care, the GP care, all aspects of care is covered by the patient participation group. And remember that patients don't choose to be ill. We don't choose to be sick. But when we are sick, it's much more effective if we work in partnership with those who are offering care at an individual level, so the clinicians who are involved, if we're involved as a partner, but also in the practice, because the service which we pay for affects us. And the PPG, as Gemma says, can feed in the intelligence that they collect from the wider patient group. Remember that it's only people who are sick who go to the practice. It's not the others out there, but the PPG who will know a lot about them. Can't park, can't get there, no bus route or whatever. It tells them about the good things about the practice, but also perhaps an indication where something needs to be picked up. Perhaps a member of staff needs to go to what I call the charm school because they're not very good at communicating quickly before it becomes a serious problem.
Yeah, I suppose bedside manner is important, isn't it, when you're going to see your doctor?
The thought is interesting, Patricia, what you just said, because that's vital for people to get to their appointments. And in Blackpool, the Blackpool Transport Service has devised a timetable which gives it for all the practice areas and the hospital, the number, the timetable, because we found that DNAs were rising, particularly in the hospital, and again, our patients have to get to that hospital.
This is non-appearance, is it? A patient non-appearance we're talking about.
Because they couldn't get there, and transport is so important particularly for older patients who don't drive and who aren't able to get there. So that's one thing that you can affect a good result. And so this table is in our surgeries, it's in all the surgeries now. And if you get the 2C or the 15 or whatever, you know where it's going to run from, what time, etc. And it'll be interesting to see, now that's in place, whether those, particularly the hospital DNA... Don't worry. Yeah.
Okay, now, I'm assuming Dr. Falarin, who's with you there, ladies, are you a GP from a surgery?
I'm not, unfortunately. Rather like Patricia, I've got a doctor. I have a PhD in mechanical engineering. And as my wife says, I know more about planes than I know about people, but I do my best.
Okay, so what I'm going to ask now is, obviously the patient participation group is almost like a customer survey, isn't it, really, in easy terms? But obviously the ladies have given us a very good indication of the sort of issues that can be raised. But who can actually be involved on a patient participation group? How do they go about getting their name put forward and bringing their views forward to a surgery?
That's a really good question, actually, and I would say it's more than a survey, because a survey for me, it suggests that it's a one-way flow of information, and the real power of a patient participation group is actually that it enables the flow of information both from medics to patients, but the patients back up into the practice, and helps both of those key groups of stakeholders ensure that they're able to work in a way that supports the other.
Right. And do you actually, shall we say, not just the members of the public that attach to each group, but do you actually deal with, shall we say, cancer groups or heart condition groups, say, as a group of people rather than just individuals?
Yes, we have specific clinics in our practice for cancer patients, for quitting smoking, for every area you can think of. And in fact, we've got an A to Z of those. And because often they're commissioned from elsewhere, they're not practitioners. Because you couldn't do it, could you? It wouldn't be possible.
No.
So we have that. We're cancer champions ourselves. One of our PPG members is a former cancer patient, so he's got a lot to bring to the table of going through the process of cancer and dealing with it.
And does this help allocate funds? Because I think these surgeries hold the funds in effect, don't they? So does it help where you challenge your funding too?
That's not in my remit.
Okay. All right.
I don't know much about funding. I just know that the NHS is very costly and nobody really appreciates the true costs of the NHS. That is one of the problems.
That is one of the big issues, and as you say, cancelled meetings and so on, and where you can best get, shall we say, if you join these participation groups, at least we're looking to improve the service and the two-way flow of information between yourself and the surgery, which is probably the most critical thing.
Can I interject here about the costs? Gemma's quite right. The public generally don't know how much the NHS costs. But perhaps we should. Perhaps we should know the cost of our prescription. It's computerized. It could put... I know there are different people, wholesalers that people may go to, but it just needs to say it costs between X and X. After all, the public know that if they go to Lidl or Aldi, it costs A, and if they go to Marks and Spencer's for their baked beans, it'll cost A. May not be the best example, but I'm sure it's perfectly clear to listeners. So we need to be informed about how much does a GP appointment cost, how much, therefore, does a missed appointment cost.
Yes. We do that, Tricia. We do that.
Well, thank you.
Trip to a nurse costs, an X-ray, people want for minor things. How much does it cost? Not necessarily good for you either.
Yeah, it's unfortunate everything has to be turned into cost these days, isn't it? So finally, before we wrap up, can I just ask quickly, where can we find more information on patient groups?
So individual practices will have their own, have their own sections on the website where they talk about the PPGs, how often they have their meetings, how to join. But we as NAP also have our website, which is a really great repository of information, case studies, tips. And the web address is www.napp, that's napp.org.uk. We can also be found on Twitter. So if you look at patient particip, and particip is short for participation, albeit without the ATION. There's a wealth of information there as well.
Well, Dr. Folarin, thank you. And to the ladies, Patricia and Gemma, thank you for your time this afternoon.
Thank you.
And I'm glad we managed to actually get ourselves sorted so we could actually talk to you. Have a good afternoon now. Take care.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Radio Live News, up to the minute.
Kia ora, good morning. Welcome to News Hub.
FBS.
It's uplifting.
The laughs that we have.
One of the best radio stations you can listen to anyway.